Research-based instructional strategies and interventions. Evidence-based practices, EBPs, and high-leverage practices for students with ASD. EBS and HLPs are both essential to provide students with high-quality special education instruction, but they are used for different purposes. EBPs are instructional strategies that have been proven to be effective through high-quality research. They are designed to improve student outcomes such as communication, behavior, or academic skills. HLPs are broad teaching practices that effective educators use with all students. They include collaboration, explicit instruction, assessment, and creating positive learning environments. HLPs describe how teachers teach, while EBPs identify which interventions research has shown to be effective for specific disabilities. Mileski et al. 2017, Steinbrenner et al. 2020. Strengths and limitations. A strength of EBPs is that they are supported by scientific research and have demonstrated success for students with ASD. However, they require specialized training and must be implemented with fidelity. HLPs are flexible and can be used across grade levels and for different disabilities, making them effective in inclusive classrooms. The limitation of HLPs is that they are less specific to individual student needs and need to be paired with EBPs. An HLP that is effective for students with ASD is explicit instruction, which provides clear modeling, guided practices, and immediate feedback. An EBP that is effective for students with ASD is visual supports, including visual schedules, graphic organizers, first, then boards, and visual cues for directions. An EBP for students ASD is task analysis, which breaks complex skills into smaller, more manageable steps and systematic prompts with prompt fading to help students acquire new skills and increase independence. An HLP for students with low-incidence disabilities is providing positive and constructive feedback. These students require immediate and specific feedback to reinforce correct responses. This helps them to understand what they did well and what needs improvement. HEN or EBPs preferred over HLPs? When addressing specific individualized needs, EBPs are preferred. When a teacher needs interventions that have been scientifically proven to be effective for students with ASD, a teacher will refer to an EBP. Examples include visual supports, reinforcement, and task analysis that have demonstrated effectiveness in improving communication, behavior, and independence in students with ASD. When targeted interventions are needed to address individual student needs, students with significant learning or behavioral needs require targeted interventions that are implemented with fidelity. EBPs are structured, research-based methods that can be individualized to meet each student's needs. HLPs are preferred when planning and delivering daily instruction because they provide a framework for effective teaching that benefits all students in an inclusive classroom. Mileski et al. 2017. HLPs are effective when creating an inclusive learning environment. HLPs also emphasize collaboration with general education teachers, special educators, related service providers, and families. Unlike EBPs, which target specific interventions, HLPs provide the foundation for effective teaching and can be applied across grade levels and disability categories.